often do you stop to think about your breathing? Every breath feels automatic until one day it doesn't. COPD and emphysema slowly make it harder and harder to breathe, often without people even realizing it's happening. And today, on World COPD Day 2025, we are breaking down what these conditions really mean, why they are rising, and what you can do to protect your lungs. Let's start with the basics. COPD stands for chronic obstructive pulmonary disease, and it mainly includes two conditions: chronic bronchitis and emphysema. Chronic bronchitis causes swelling and excess mucus in the airways. Emphysema damages the tiny air sacs in the lungs, trapping air and making it difficult to breathe out properly. Globally, over 390 million people live with COPD. India alone has nearly 55 million cases, making it the second highest in the world. And here is something most people get wrong. It's not just smoking. Air pollution is responsible for almost 50% of all COPD cases. Tobacco contributes another 20 to 25%, and the rest come from workplace dust, fumes, and even genetics. Let's understand emphysema a bit more. In emphysema, the tiny air sacs, your alveoli, lose their flexibility. Stale air gets trapped inside, and you begin to feel breathless. At first, you notice it during physical activity, but over time, it can happen even when you're just sitting or resting. Here are some symptoms you should watch out for: constant breathlessness, chest tightness, frequent lung infection, unexplained weight loss, and sometimes swollen ankles. These signs often show up slowly, which is why early testing is so important. Early diagnosis genuinely saves life. COPD is usually diagnosed with a simple test called spirometry, which measures how well air flows in and out of your lung. There are 4 stages: mild, moderate, severe, and very severe. These stages help doctors decide the best treatment plan for each people. Now let's talk about treatment, and yes, there is hope. The very first step is quitting smoking. If you smoke, doctors may prescribe bronchodilators, inhaled steroids, or other medication to open up the airways and reduce inflammation. In advanced cases, oxygen therapy may be needed. Another extremely helpful option is pulmonary rehabilitation. These includes breathing exercise, fitness training, nutrition support, and stress management. Your lungs may not fully heal, but with the right care, their functions can improve and your day-to-day life can get easier. Living better with COPD is absolutely possible. Gentle exercise helps keep your lungs stronger. Eating a balanced diet, staying hydrated, and avoiding polluted areas or secondhand smoke can make a huge difference. Vaccines for the flu and pneumonia are also very important because infections can make COPD much worse. Emphysema, by the way, is a type of COPD, and although the lung damage can be reversed, early action slows down how fast it progresses. The earlier you take charge, the better your lungs will support you in the long run. This World COPD 2025, remember the simple line: short of breath, think COPD. Take every breath seriously and help others to do the same. If this video helped you understand COPD better, please hit the like button, subscribe to Healthwise Digest, and share this video with someone who may need it.